Good morning, everyone. I'm Dr. Prashant Patil, a consultant pediatric endocrinologist at Apollo Hospital, Navi Mumbai and SRCC NH Hospital, Mumbai. Today, on eve of World Obesity Day, I'll be discussing 5 punches of obesity. So we'll discuss every features in terms of points. So let's start with different types of obesity. The first one is most common polygenic obesity. Second, endocrine obesity. Third, monogenic, where there is a one gene which is affected. Fourth, genetic or syndromic obesity. And fifth and final, drug-induced obesity. Now coming to 5 salient features of polygenic obesity. So this type of obesity first always seen in generally in 5 years or above children. Second feature, they are always tall and obese. Thirdly, they do not have any features of dysmorphism. They have normal intelligence. And finally, there is no special senses affection like vision and hearing. Their vision and hearing is absolutely normal. Now, how one should suspect a monogenic obesity? Again, 5 pointers. The first pointer, it is always early onset severe obesity. Second, most of the times it is associated with polyphagia. Thirdly, they have a typical features of dysmorphism like red hair, polydactyly. Fourth, they generally have a low or subnormal intelligence or mental retardation. And fifth, they will most of the times they will have vision affection like night blindness or some abnormalities in fundus. Now coming to 5 dreaded complications of obesity. First, type 2 diabetes. Second, hypertension. Third, dyslipidemia and ischemic heart disease. Fourth, obstructive sleep apnea. And fifth, non-alcoholic steatohepatitis. Now coming to what are the different 5 components of metabolic syndrome in the definition. So first component and a central component is waist circumference which is more than 90th percentile for the respective age. Second, blood pressure centiles which is more than 90th percentile for that particular age and gender. Third, your high density lipoprotein or HDL which is less than 40 milligram per deciliter. Fourth, your fasting sugar which is more than 100 milligram per deciliter. And last, triglyceride which is more than 150 milligram per deciliter. Now, what are the screening investigations that you will perform in obese children? First, fasting sugar to rule out impaired glucose tolerance or frank diabetes. Second, lipid profile in fasting state. Third, thyroid function test to rule out hypothyroidism. Fourth, liver enzymes like SGOT and SGPT to rule out non-alcoholic steatohepatitis. And fifth, if there are features of obstructive sleep apnea, you will order a polysomnograph if the facilities are available. Now, coming to the do's in the management of obesity, we should always remember the first point that a timely and regular meal time is most important. Second, only give the culturally acceptable food. Third and most important feature is control the portion size. Fourth, daily activity of 30 to 60 minutes graded and age appropriate exercise is must. Fifth pointer which is often neglected is adequate amount of sleep. Now coming to 5 don'ts in the management of obesity. Avoid fancy diet or food faddism. Avoid some special diets like keto diet, paleo diet or any XYZ diet. These are not good for a growing children. Second, intermittent snaking or grazing should be avoided. Third, do not target too much of rapid weight loss. Fourth, do not start on anti-obesity medication the way we generally start in adults. Please remember that anti-obesity medications are not approved in pediatric age group. And lastly, a pediatric surgery is not a straightforward option in all cases of pediatric obesity, but it is reserved for certain special types of obesity like monogenic obesity or a syndromic obesity, which is not amenable to your lifestyle modification and a pharmacotherapy. So thank you so much for your patient hearing. And at the end, I would like to thank Navi Mumbai IAP, especially Dr. Jitendra Gawane and Dr. Satish Shane for giving me this wonderful opportunity. Thank you so much. Bye everyone.